Okay, before I start the speech, I want to start with a question. What do a sex offender, a patient with prostate cancer, and a minor all have in common? What they have in common is that they could all be prescribed the same drug that will forever alter their bodies. And so, the reason to listen is there's a ginormous dollar sign on minors currently today that are claimed to be suffering from gender dysphoria and seek gender affirming care. What I mean by this is medical officials and practitioners are charging high prices for gender affirming treatment and care to minors as young as 12 years old. And contrary to what hospitals and medical professionals may say, gender affirming care is not helpful, it's not safe, and it also should not be given to minors. And I've studied this topic in depth, and I've also firsthand seen the harmful effects of gender ideology being used to affirm things outside of God's creation via family members. And so first, just preview of the main points. First, I will discuss what gender affirming care is and how it is harmful. Second, I will discuss a drug called Lupron, a drug that is prescribed for patients with gender dysphoria. And finally, I'll provide a reasoning for why Christian counseling is a more viable treatment method for patients seeking gender affirming care. And so, first point again, what is gender affirming care? Gender affirming care, defined by the World Health Organization, encompasses a range of social, psychological, behavioral, and medical interventions. And they say it is designed to support and affirm an individual's gender identity. And so, to more go on to how it was fleshed out in the actual care portion, according to the Association of American Medical Colleges, the list of gender affirming care is as follows. It starts off with counseling, just regular face-to-face verbal counseling. Then it goes to speech therapy. So patients that are seeking to change their voice to match their desired gender will take voice lessons to sound like that gender. If it's a man wanting to sound more feminine, they'll go for that reason, and vice versa for women. Then is hair removal surgery. Men will get hair permanently removed from their face and other parts of their body to appear more feminine. Next from that is puberty blockers, which is given to minors before the age of puberty. And this is used to slow, it's prescribed or it's advertised as putting a pause on puberty. You put that pause on puberty, you wait, you figure out who you are, and then you can start that, which is really not safe at all. Moves on to hormone therapy, so this can be given to anybody, and hormone therapy replaces your normal sex hormones and gives you the hormones of your desired gender. And finally, surgery, sex change surgery, that is. And what should be noted again is who is available to obtain these procedures. It's minors. Minors are able to start with these procedures at a young age whenever they can make their own choices and work from there. And these treatments are sometimes irreversible, if not all the time. Which leads me to the drug Lupron. As I discussed the gender affirming care, what it is and how it's treated, this leads me to Lupron. The Lupron drug is what is prescribed to patients that are seeking to halt puberty and have hormone blockers. As I already said, it's used to delay puberty in minors. In a recording, according to a reporter for the Daily Wire, Christina Buttons, she interviewed endocrinologist Dr. Mike Laidlaw, and he had to say that chemical castration is effectively when a medication like Lupron is used to stop the pituitary gland from communicating with the testicles or ovaries to drastically lower sex hormone levels. It is no different from the gender affirming care given to adolescents, he said. Basically, to kind of sum up what he said, Lupron is chemical castration. It's interesting to know the history of Lupron, and it started out as prostate cancer treatment. They were given to men that had prostate cancer, and once they did this for a while, they found that Lupron had castration effects. And so once they learned that it was castrating men, they started giving it to sex offenders. In a study given by the National Library of Medicine, it released a study on sex offenders, giving them different doses of Lupron. The higher the dose, the worse the outcome. Contributes to their castration, and also it contributes to their desire to reoffend. Not only reoffend, but more violently sexual than before. And so, it is without question that this type of treatment for minors is no treatment at all. It's harmful. and it's no form of care. It leads them to castration, and they're just too young to make that decision for themselves. In Canada, they can make these decisions without parents' consent, and it's just wrong. Their brains haven't fully developed. And so a more viable form of treatment for children, specifically minors, that are desiring gender-affirming care and claim to have gender dysphoria is Christian counseling. Christian counseling is more patient-centered than gender-affirming care. And what I mean by that, it focuses on the whole patient, not just their desires. It focuses on their brain, their psychological state, and also works to bring them closer to God. And so, just to preface, Christian counseling is whenever Christian counselors bring in secular counseling techniques and brings them into practice through a Christian worldview. And Mark McKinn, a clinical psychologist and psychology professor at Wheaton College, says the same thing. He defines Christian counseling as this: it is a type of therapy that integrates traditional talk therapy methodologies with Christian belief practices by incorporating theological concepts. And it should be noted that Christian counseling differs from biblical counseling for this reason. Christian counseling, as I already said, brings in secular concepts. And a prominent figure of the LGBTQ community that left and became a Christian is Jackie Hill Perry. She is a prominent speaker and Christian and has a popular testimony due to her being used to being identified with the LGBTQ community until she was saved by God. And she says that she used to tag her pants like a man, she tried to walk like a man and talk like a man, and try to appear as masculine as she could. And then she goes on to a youth conference and speaks on how she was brought up to believe that she was helpless to be a girl, did not fit into the box of womanhood the culture at the time put on her. And so on that, she states, "There is this confusion that I had that was brought about by people teaching me womanhood that did not come from the creator of woman, but from the culture." And to wrap up about Jackie Hill Perry, young people just like her are influenced by the culture they're surrounded by. And they should not be taught to appease the culture through the mutilation of their own bodies, but they should be taught how to be steadfast. The only way they can do that is through having a foundation as Christ. And so, in conclusion, I first talked about gender-affirming care and what it is. Second, I spoke on the drug Lupron and how it is used to block puberty and hormones and its harmful effects. And finally, I wrapped up the main points by discussing why Christian counseling is a more viable alternative form of care. And so this is all just to say one more time that gender-affirming care should not be given to minors. It is a step towards the grave and a life of misery rather than one of peace and happiness and fulfillment. Instead of pushing children to reject a fundamental part of themselves, they should be taught how to steward their gender for the kingdom. They cannot do this apart from God, which is what all men, women, and children should do, and need above all else, a stable relationship with God, their Creator.
Here's my audience. 1, 2, 3, 4, 5.